Trace Minerals, Chapter 13 in Nutrition. When we look at minerals, we know that the periodic table looks very similar to what you probably had in high school chemistry class. Trace elements are 100 milligrams per day or less, so that not very much is needed in the diet. They're crucial to many body functions, including the metabolic pathway, and they're found in animal and plant foods, and their function is mostly regulatory and structural. These trace elements are important because they are cofactors to enzymes. They help with the immune system making hormones. They help with reduction reactions with our oxidation, and also trace elements are important for the growth of the body. Looking at iron, it's probably one of the most important minerals that we'll be talking about because we have so many patients that are iron deficient, they are anemic. It's got functions as far as oxygen transport. So looking at some of the things I discuss in PathoPhys or with nursing students, we talk a lot about iron is that hema portion of hemoglobin and myoglobin and how they bind and release oxygen easily. That hemoglobin transports oxygen in the blood. So without oxygen getting to the cells, the person is anemic and very crucial for the homeostasis of the body. 80% of functional iron is found in the red blood cell as a hemoglobin, and we know that we can check red blood cell levels, we can check hemoglobin and hematocrit levels, and they tell about the oxygenation of that person. The iron's ability to carry oxygen is crucial, and we know that those two hema are proteins, and those are hemoglobin and myoglobin. Myo meaning muscle. Hemoglobin is that red blood cell transport oxygen, and myoglobin is then that muscle that facilitates movement of oxygen into the muscle cells. We know with the immune system iron is necessary, but as a negative, it also serves as a nutrient for bacteria, so it can worsen infection as a negative, but most of the time iron is a very positive. As I said, it helps with the immune system. Regulation of iron absorption is important. That intestinal wall acts as the gatekeeper, and it forms that initial barrier. Most of the absorption is in the duodenum and the jejunum. Iron will then be used by the cells. It will be released into the blood and carried as transferrin, which is a protein, and it can also be stored as ferritin. And the iron absorption will depend on the needs. So a woman that is pregnant and growing more tissue and growing a placenta will actually absorb a lot more iron, and that's why the GI system slows down, so iron absorption can be increased during that time of need for a pregnant woman. That also then regulates or goes into why women that are pregnant have more constipation or slower motility problems. But looking back at iron, we know that the bioavailability varies from 1% to 50% in that GI tract. Important to remember also is hema iron is hemoglobin and myoglobin, which comes from animal tissue. It's more absorbable. So when you look at increasing the iron levels for a person, animal products are usually recommended because they're better absorbed and you get more iron from that source. Non-hema iron is found in your plant-based, and that is like your iron-fortified foods. Vegetarians have a decreased hema iron because they don't eat the meat or the animal products that give you the good source of hema iron. When we look at the absorption effects, then we know that iron is stored in the liver, bone marrow, spleen, and the skeletal muscle, and most of the iron is recycled to make new red blood cells. Infants are of special concern because iron is stored in the liver. We know that with the amount of growth that infants have, that becomes very crucial for them. So there are many factors that enhance or inhibit absorption, and we need to consider those with diet and when we have somebody that's anemic. Iron turnover and loss becomes important as we think about meal composition. So what you eat with that iron-rich food helps either to enhance the absorption or not. The two most important dietary factors that boost the absorption of that non-hema or that plant-based iron is the organic acids. So vitamin C or orange juice enhances iron absorption, and that's a question many of the state boards for nursing licensure, NCLEX, will ask. To increase iron absorption, you would consume that with, and it's a vitamin C rich food like an orange or grapefruit or any citrus that would be included in that. When we look at the dietary recommendations, as I said, red meats, liver, and seafood are very rich in iron. And toxicity can be a concern. Children that take Flintstones vitamins and have an overdose of iron, that can become a big concern. People that are deficient are usually anemic, and what we see when we assess them is they look very pale or white, very tired and lethargic. Their oxygen binding to the cells decreases, and that explains why they're tired and pale. Iron deficiency is the most common nutritional deficiency in the world, especially in many of our developing countries. In women, adolescent girls that are growing and menstruating, pregnancy, infants, and toddlers. Very common is to have iron deficiency. It's most prevalent in the child that's 6 to 24 months because of the increase and rapid growth and brain growth during that time. And also during that time they're starting to eat table food, but they aren't eating the meat or the things that take teeth and a lot of chewing and digestion. They don't consume that. There is a link between iron deficiency and decreased development in children, and many children when they go for their well baby visits will have their hemoglobin checked by their healthcare provider to assess for iron deficiency. Zinc, the functions of that, it is a component of every living cell, and we know that for proper functioning more than 80 enzymes require the function of zinc. The immunity is related to the function of zinc. Eye health, many people will take zinc supplements for eye health or supplements with that. And then as you can see, zinc is very important to many parts of the body for protein and lipid metabolism, to help with night vision, sexual maturation, hormone activity, cell replication, and growth. And we know that the muscle and bone contain about 90% of the body's zinc. The regulation of zinc in the body is very similar to iron, where the absorption can be affected by many things in the GI tract, what has been eaten with the zinc, and we know that zinc is also found in our meats and seafood. So when we think of iron and zinc, there's a lot of parallels or things that these two minerals have in common. Deficiency, again, is poor growth and delayed development, but we also see problems with healing of wounds, and many of your woundostomy nurses will require a little more zinc in the diet to help with the healing of surgical wounds. Malabsorption can be seen in a condition called Crohn's disease, where they have problems with their small intestine and absorption becomes a consideration. Selenium is part of our antioxidant enzymes. It helps with your thyroid metabolism and also immune. It helps with the free radicals to kind of stabilize those. Our dietary recommendations found in a lot of our organ meats and seafoods. We don't see a lot of deficiency, and toxicity is not very commonly seen either, but it's noted with brittle hair and nails. Our iodine in the diet is from our seafood, and the deficiency with iodine is a condition called goiter or creatism. The ocean is really our best source of iodine food, and because we live in the Midwest and we don't eat a lot of seafood on a regular basis, this was called the goiter belt because we did not have a lot of iodine in our diet. So what they did was they iodized our salt, and salt is the #1 source of iodine today. It's also found in milk and some dairy products, but the thyroid gland uses iodine to make T3 and T4, which are hormones of the thyroid. As we look then at the recommendations Again, our goiter is the enlargement of the thyroid gland. It's very rare. And creatism is a very preventable condition where a child has mental retardation because during the time when the woman is pregnant, the fetus does not have enough iodine, and they then have a child that has mental retardation. Copper has many functions. The most important that we look at is the antioxidant and also the immune function. Meniere's syndrome is a very rare deficiency of genetic disorder causing neurodegeneration. Iron and zinc interfere with copper absorption, so if you have somebody that takes a lot of iron supplements, you might have a copper deficiency noted. Manganese is also an antioxidant. It's got some poor absorption, and so that can be kind of a consideration. The deficiency is often seen in people with epilepsy or multiple sclerosis, but not usually one of the vitamins or minerals that we talk about very often. Fluoride has been added to water since 1945. I believe Detroit was the first city to fluoridate water, and what we know about fluoridation is it helps with the enamel of the teeth and to keep the teeth of people strong. The dietary recommendation then is to not overdo, and most of the fluoride is in the bones and teeth and supports mineralization. Chromium helps with glucose metabolism. People that take a lot of antacids can have decreased absorption of chromium. It's found in a lot of food sources, dark chocolate, nuts, and whole grains, so things that we like to eat. Also found in green beans and many of our things like spices and brewer's yeast. Molybdenum then is absorption. Dietary recommendations, again, we don't see a lot of these trace minerals discussed or deficiencies of them. Our other trace elements, arsenic, selenium, vanadium, not very oftenly talked about or seen. When we look at the impact of fluoride, we know that the American Academy of Pediatrics recommends fluoridated water sources, and that is important if you were a community health nurse, because you would possibly have families that live in rural areas that drink well water that is not fluoridated. So those children either need fluoride supplementation or they need to purchase water in town and have the children drink that. When we look at things that affect the bioavailability of minerals, we look at such things as the intestinal environment, how acidic it is, how much a person needs, how much fiber is in the diet that can affect the absorption of any of our minerals that we have. We know that it depends for iron on the iron store that the body has, and it can vary from less than 1% to greater than 50%. We know the GI tract increases absorption of iron when it's needed, but that can be a problem for people that have issues with their small intestine, such as Crohn's disease. Foods that are high in iron are listed here. We know then exceptionally good sources are many of our meats. Cheerios cereal is a good source, and that is an easy one for parents of toddlers 6 months to 2 years of age to increase in the diet to help with growth and tissue growth during that time. In Grandma Skillet, when we look at the cooking, and we know that cooking in an old cast iron skillet increases the absorption in foods, and that is a good way to increase the iron if you can cook in a skillet. And many people have gone away and are using Teflon skillets, so we're missing and having more iron deficiency as a result of change in even just the utensils we're cooking our food in. We know then that the plankton and plant life are having issues, and our oceans are becoming anemic. And lastly, looking at iron poisoning in children, that is a leading cause of poisoning in the United States because the Flintstones vitamins are oftentimes overconsumed by children that think of them as candy. And I have seen children hospitalized before with iron overdose, with vitamin overdose. They need to call poison control. We put the children with iron overload or iron poisoning on telemetry and try to chelate or get that out of their body before it causes a lot of long-term problems. And we know that there's a condition called hemochromatosis, and it's a hereditary condition that is chronic overload. It's more common in women because women, or it's more common in men because women have that monthly blood loss with menstruation, and it's very prevalent in your African community due to genetics. Thank you.